My name is Dr. Kristen Wright at Boston IVF, and I'm here today to talk to you about what it means if we call your embryo aneuploid or abnormal. So when you do IVF, you have the option of doing extra chromosome screening of your embryos. This is an extra step in the process where we biopsy the embryos to see which embryos have chromosome problems and which don't. Many embryos look fine and normal to us in the petri dish, but have these underlying chromosome problems such that they're not going to make a successful pregnancy. We can't tell that just by looking at the embryos, but we can tell that if we do a biopsy. What we're looking to see in that biopsy is whether the embryo has the correct number of chromosomes. If it does, then we will call that embryo euploid or normal, and we will recommend transfer of that embryo, and that embryo would have a decent chance of making a successful pregnancy for you. If we call the embryo aneuploid, that means that it has an incorrect number of chromosomes. It either has an extra chromosome or it's missing a chromosome. Those embryos, unfortunately, we don't expect to make successful pregnancies. Sometimes those embryos will implant, but then will miscarry. Other times those embryos might implant, but then go on to a live birth of a baby that has a chromosome problem like Down syndrome or other types of chromosome abnormalities. So we're hoping for chromosomally normal euploid embryos for you to transfer.